So I'm really excited about meeting Priya. Priya is a 3-month-old, I believe, Lagotto breed. Actually, 18 years as a veterinarian, I've never had a Lagotto as a patient. The great story about Priya is Julie adopted this dog because the breeder was going to euthanize the little thing just because she had a defective eye. I think it's become pretty clear that this breeder is more of a puppy mill type breeder and is just getting rid of these dogs as fast as they can to make a lot of money. So thank goodness there's people like Julie out there to save this little thing. So we've diagnosed her with microphthalmia. As I discussed, it's a congenital defect. There are some risks of sort of complications later on in life, glaucoma, some inflammation of the eye, some things that may be painful.
I don't know how she's going to see on that side.
We'll figure it out. Yeah, we'll check it out today. I should have. Nice
sorry,
to meet
Julie,
you.
nice to meet you.
Found the place okay?
Yes.
What do you think her eyesight's like? Like, how do you see her interacting?
When we first met her, her eyelid was actually closed even more. So it started to open as she's grown. And recently, probably within like the last 3 weeks, it seems like she might see some movement.
Okay, good. And we'll certainly run some tests today to figure it out. I'll kind of look at the rest of her first, and then we'll focus on her eye. I'm talking about her doing sort of work, right? Like hunting or whatnot, or fly ball and agility. You know about these guys being truffle hunters?
Yes.
Yeah, very cool. It's a very traditional Italian hunting dog. Interesting thing about the Lagottos is back in about the 1500s, they were bred and selected and trained to sniff out truffles. Very specific, just truffles. I guess there was a huge truffle trade going on between Italy and the rest of the world. When you have this done regularly, do they use the strip on the eye? Or do they
no,
make it up
it's
like this?
generally the drop, yeah.
Yeah.
Yeah, they generally do it in the syringe.
Alright, so if there's an ulcer, this green-yellow water is going to stick to it, and then it's going to flare up, and we're going to see if there's a scratch.
Good girl, Priya.
So far, so good. Let's do it again with a little green to it.
Good girl, Priya, yes.
You want to grab the light, Julia?
Sure.
Thank you.
Good girl, Priya.
She's being excellent.
Good girl.
So no ulcer.
So good.
Definitely some pretty major cataracts. The interesting thing about the cataracts in these cases is it can melt. Like the cataracts can dissolve and break down.
Read.
The problem is it can then lead to inflammation and some pain. So we'll have to see what happens later. But
would she be a candidate for a cataract surgery, or would it be?
I don't think so.
Yeah.
No, not at all. There are some risks of sort of complications later on in life, glaucoma, some inflammation of the eye, some things that may be painful. But all in all, her chances are excellent. She's going to do fine. I mean, there may be some surgeries or treatments that are needed later on, but she's going to live her full life. She's going to be a fantastic dog. So we got Pedro coming in a minute. I'm really worried about this little guy. Pedro was rescued from a delinquent owner that was just kind of ignoring this dog, and Veronica did the right thing and took on this dog that came with a lot of costs and a lot of healthcare issues.
So I ended up bringing him in, and we ended up doing tests, and we found out he had bladder stones, and the bladder stones were really big. And then we also found out he had stage 3 dental. And he had an infection that was all up in his nose, and it was in his liver, and it was everywhere. So we did a 3-in-1 surgery in one day, and we were kind of nervous because we didn't know how he's going to respond to all the treatment and to everything.
But Pedro's been doing great. Unfortunately, he may be blind, so Veronica has messaged me and said that Pedro's bumping into things. Alrighty, Pedro, so what exactly happened other than this eye being bothersome? You're saying he couldn't see?
No, he couldn't see. He was bumping into things.
Okay.
And it started when I called in to make the appointment.
So before we shine lights and do everything else, let's take some of the pain away. One of the things I will do is I'll check his eye pressure.
Okay.
And I'll do both eyes as a comparison.
Good boy.
Nice. 9. I like it to be under 20,
Okay.
ideally. There's going to be quite a variation with this. 11. So we kind of take the average more than anything.
Okay.
27.
Ooh.
Alrighty. So next is the eye stain. So the way this is going to work, this weird greeny yellow stuff does not stick to the outer cornea.
Okay.
But if there's a scrape in the cornea that causes the second layer to be exposed, this is going to stick to it.
Okay.
Just gonna wipe it.
Still moving.
No ulcer that I can see so far. So I'm pretty worried about Pedro. His eye tests all came back relatively normal, but the eye doesn't look normal. There's some significant swelling, some significant redness and edema. And I've prescribed some medication. We're going to see if it helps clear things up, but only time's going to tell what's going on in that eye. And I am a little bit worried about a tumor or some sort of defect that's going to be structurally severe enough that we may actually have to remove that eye. So hopefully things work out. But we're all going to pull for the little guy, that's for sure.
He doesn't really bump into things as much anymore. The only main thing is that like his eye just kind of looks a little bit blue still, and he still kind of has like his episodes where he just like can't see things. So I don't know if it's working too well. So I'm getting kind of worried that it's something more than we thought it would be. It's just getting me kind of scared.
I'm a little more sort of interested in something called uveitis, which is inflammation of the interior of the eye. So you think of the eye like a water balloon, essentially. Well, if the water is infected due to various conditions, you get inflammation of the inner eye called a uveitis, which can be very serious, but certainly has a lot better chance of cure than a mass. So we've got Pedro back today. Pedro's the little chihuahua that Veronica adopted from the kind of the neglectful family. We saw him for his eye condition. He continued to develop increased pressures within the eye, or glaucoma. We still don't know if the glaucoma is primary glaucoma or if it's due to something like a tumor. But either way, unfortunately, we haven't had much success controlling his pain or controlling his pressures. So today we're going to be removing the eyeball.
So first we started with doing a TPR on Pedro. So we checked his temperature, his heart rate, and his respiratory rate. Once we saw that everything was okay and within the normals, we were able to prep to put the IV line in. So that just was a catheter, and then we connected to the IV bag. So I just tried to put in the first IV catheter, didn't go through. It's supposed to just slide in. It didn't get enough blood back, so I had to take it out. But hopefully the second one will work better.
Okay, you can go. Okay, hold off at the top.
At first, Veronica was quite upset, understandably, and wanted to see if anything could be done to avoid it. But once she realized how painful Pedro was, that she sort of realized that he can't be on eye drops the rest of his life, and even with eye drops, he was going to have to be on some pretty powerful pain medication. The eye really only has one purpose, and that's to see. This eye has no eyesight. It will never regain eyesight. It's just going to be a constant source of problems. All sort of full disclosure, I actually haven't done this surgery since 1997, when I was a second last year in veterinarian school. I've always had the pleasure of being able to work with eye specialists, so I've always had them deal with eye enucleations. You know, although I'm confident in my ability, if I don't do this properly, if I am not very, very careful and focused, he could lose a lot of blood. Also, if I traumatize that optic nerve in his right eye, the one that I'm removing, it can actually affect the optic nerve in the left eye. So I can damage some of his eyesight in his one remaining eye. So Pretty tricky. We have to sort of be careful, and only time will tell how he's going to do, but with some skilled hands and some great help from the team, and Pedro's a pretty tough cookie, I think he'll do great.
See. So the technique we just did leaves all this sort of tissue and fat.
Cliff's just stitching it up. Everything's going great.
I think it's just annoying. I think it just, the hairs will continue to grow and they can grow into each other. And I messaged her and said, "What are you doing? get me some more pain, or come get some more pain meds."
Good, so Pedro's surgery is finished, and he did fantastic. Not only was he a great patient under anesthetic, and my team did a great job in monitoring his blood pressure and his heart rate, he was pretty stable the entire time. I was able to remove the eye without major difficulty. Certainly took me a little bit longer than it would somebody who's done this, hundreds of times.
So we just did a TPR on Pedro. His temperature was great, so we were able to take him off the fluids because that's to maintain his temperature at the normal range. We're going to give him some food. Hopefully he'll eat, and we'll take him out to go to the washroom, and then his parents can come pick him up.
So here we are about 2 hours after surgery, and Pedro, although he's a little sleepy and kind of enjoying the pain medication, probably seeing some nice colors and having some nice dreams. He's recovered very, very well. He certainly is checking things out and walking around in his cage, and doing great. Sporting a nice little pink stain on his face from the soap. I think it looks good for him. So he's done about as perfect as we could anticipate. I think the eye closed up really nicely. It just looks like he's winking a bit. There's no sort of deep cavity or caving in appearance, and it's not bulging too much either, so it couldn't have gone much better than we anticipated. So I think both he and I are very happy, and he will continue to do fantastic. So thank you very much to my team, and of course thank you to Pedro for being such a good patient, and we will be seeing him for many, many years, which is great. Hey, you did good. Time to go back to bed.